Welcome to the lab. Today we are talking about something that quietly harms millions of older adults every single year. And most people don't know it's happening until serious damage is already done. Kidney disease, silent, invisible, and deeply dangerous. According to the National Kidney Foundation and the CDC, approximately 37 million Americans are living with chronic kidney disease, and 9 out of 10 don't even know it. If you are over 60, have high blood pressure, or have been told you have diabetes, your kidneys may already be under threat. Today, I am going to walk you through 7 silent warning signs your kidneys may be failing, signs your doctor may not have warned you about. Stay with me through all 7 because sign number 7 is the one that surprises nearly every patient, and it could be the most important one you'll ever learn. Before we go any further, I want to ask you something personal. Have you noticed any unexplained swelling in your ankles or feet recently? Or perhaps you've been feeling tired, not just a little tired, but deeply, persistently exhausted, even after a full night's sleep? Maybe you've been waking up more often at night to use the bathroom and assumed it was just part of getting older. I want you to think about that. And in the comments below, tell me, have you or someone you love experienced any of these things? Your answer may help someone else in this community recognize something important. Leave a comment. We read every single one. Here is what you need to understand. Your kidneys are 2 fist-sized organs that filter approximately 200 liters of blood every single day, according to the National Institute of Diabetes and Digestive and Kidney Diseases. They remove waste, balance fluids, regulate blood pressure, and produce hormones. Your bones need to stay strong. When kidney function begins to decline, what doctors call a drop in the glomerular filtration rate, or GFR, the body does not sound an alarm. It compensates silently. A landmark 2014 study published in the Journal of the American Medical Association confirmed that early-stage chronic kidney disease produces almost no noticeable symptoms in the majority of patients. That is exactly why knowing these 7 signs is not optional. It is essential. Sign number 1, persistent fatigue and brain fog. When the kidneys are struggling, they produce less of a hormone called erythropoietin, EPO, which signals your bone marrow to make red blood cells. Fewer red blood cells means your tissues, including your brain, receive less oxygen. The result is a deep, heavy exhaustion that sleep does not fix, and a mental cloudiness that makes concentrating feel like pushing through thick mud. If you have been blaming age for this fatigue, it is worth asking your doctor to check your kidney function and your hemoglobin levels together. Sign number 2, swelling in the ankles, feet, or around the eyes. Healthy kidneys regulate sodium and fluid balance. When they can no longer do this effectively, sodium accumulates in the body, pulling water into tissues. Doctors call this edema. It is most visible in the lower legs and ankles by late afternoon, and sometimes around the eyes in the morning. This is not the same as the minor swelling you might get from standing too long. Kidney-related edema tends to be persistent, bilateral, meaning both legs at once, and it presses back slowly when you press a finger into it, leaving a small indent. That specific detail, the indent, is called pitting edema, and it is a red flag that warrants an immediate conversation with your physician. Sign number 3, changes in urination. This is one of the most overlooked signs because many older adults assume urinary changes are simply part of aging. But kidney disease produces very specific patterns. Watch for urine that is foamy or bubbly. This can indicate protein leaking from the kidneys, a condition called proteinuria. Watch for urine that is darker than usual or has a reddish tint, which may indicate blood in the urine, hematuria. Watch for needing to urinate more frequently, especially at night, or conversely, urinating much less than usual. Any of these changes, especially foamy urine or blood, should prompt a same-week urine test through your doctor, not a wait-and-see approach. Sign number 4, persistent dry and itchy skin. The kidneys help maintain the correct balance of minerals, phosphorus, calcium, and sodium, in the bloodstream. When this balance is disrupted, the skin often reacts. Uremic pruritus, the medical term for kidney-related itching, affects up to 40% of patients with advanced chronic kidney disease, according to research published in the Clinical Journal of the American Society of Nephrology. This type of itching is typically worst at night, affects large areas of the body rather than one specific spot, and does not respond well to standard moisturizers or antihistamines. If you have unexplained persistent itching with no clear skin condition, ask your doctor to run a comprehensive metabolic panel and a GFR test. Sign number 5, a persistent metallic taste in the mouth and unexplained loss of appetite. When the kidneys can no longer adequately filter waste from the blood, urea, a waste product, accumulates. The body partially breaks this down into ammonia, which can cause a metallic or ammonia-like taste and a general aversion to food, especially meat. This symptom is strongly associated with a condition called uremia, which occurs in more advanced kidney dysfunction. A 2020 review in the American Journal of Kidney Diseases cited taste changes and appetite loss as clinically significant early markers of declining GFR in elderly patients. If food simply tastes wrong, or if you have lost more than 5 pounds without trying, this is not something to ignore. Sign number 6, shortness of breath that seems out of proportion. When kidneys fail to remove excess fluid, that fluid can accumulate in the lungs, a condition called pulmonary edema. This creates a sensation of breathlessness even during light activity like walking to the kitchen or climbing a few stairs. Separately, anemia from low EPO production also reduces oxygen delivery to your muscles, compounding the sensation of breathlessness. It is important to note that shortness of breath has many causes, including heart disease. However, if your breathlessness is accompanied by any other sign from today's list, the combination significantly raises the likelihood of kidney involvement. Always treat unexplained breathlessness as urgent and seek same-day medical evaluation. Now, here is something most doctors don't tell their patients about managing breathlessness safely at home. This simple chair-based breathing exercise, supported by guidelines from the American Thoracic Society, can help calm your nervous system and reduce the sensation of breathlessness between appointments. Sit upright in a firm chair with both feet flat on the floor. Rest your hands gently on your thighs. Breathe in slowly through your nose for a count of 4. Hold gently for 2 counts. Then exhale slowly through pursed lips, as if you are cooling a hot drink, for a count of 6. Repeat this 4 to 6 times. The extended exhale activates the parasympathetic nervous system, reducing the fight or flight response that worsens the sensation of breathlessness. Safe modification. If you experience any chest pain, dizziness, or worsening breathlessness during this exercise, stop immediately. In that case, simply close your eyes, place one hand on your chest, breathe at your own natural rhythm, and call your doctor or emergency services. And now, sign number 7, the one I promised you at the very beginning. This is the sign that surprises nearly every patient because most people think about it completely backwards. High blood pressure that is suddenly very difficult to control, even on medication. Most people know that high blood pressure can cause kidney damage over time. What they don't know is that this relationship is bidirectional. Damaged kidneys also cause and worsen high blood pressure. According to the Mayo Clinic and the National Heart, Lung, and Blood Institute, impaired kidneys retain excess sodium and fluid, increase the activity of a hormone system called the renin-angiotensin-aldosterone system, RAS, and this directly drives blood pressure higher in a self-perpetuating cycle that is very difficult to break without addressing the kidneys directly. So if your blood pressure was previously controlled and has now become unpredictable or resistant to your current medications, this is not simply a blood pressure problem. It may be a kidney problem that is driving the blood pressure problem. This specific pattern, treatment-resistant hypertension combined with any of the other 6 signs today, is one of the most important things you can bring to your doctor's attention, and it is why a simple blood test, a GFR and creatinine level, could genuinely change the course of your health. I've summarized everything on the screen. Take a screenshot right now, or download the free guide from the description below. I want you to keep this somewhere you'll actually see it, on your phone's home screen, beside your blood pressure monitor, or on your bedside table. Because here is the truth. When you are tired or worried or lying awake at 3 in the morning because something feels off, the last thing your mind can do is reconstruct a list of 7 medical signs from memory. Having this summary in front of you removes the guesswork entirely. You don't have to wonder, you just look. It makes a difference between catching something early and letting weeks pass. That is not a small thing. That is your health. And at our age, early action is everything. Knowing these signs is the first step, but protecting your kidneys and your whole body long-term takes a little more. And that is exactly what the next video covers. Click it on your screen right now. It is the perfect next step for your body. Subscribe to the lab. Stay strong. Stay safe.